I actually say, because people can wake up in the night and they're like nauseous. So it's like I leave crackers by the bedside table.
Yes. Yeah,
right? So like
sure.
even when you wake up or like right before bed, you have a little snack. Because again, if you're doing like marathon 24 hours a day, then it's okay to have a little snack.
So you're pregnant now. Woohoo! And we're so excited because, it might have been a journey. It might not have. Either way, it's exciting times. Now, between 6 and 8 weeks, you may experience nausea. It might start to kick in and it might go away, or it could stay all the way till the second trimester. That's the standard that I see, or the common, I should say, pattern is if it starts between 6 to 8 weeks and it kind of kicks in and it keeps going to 12 weeks untreated. And some women, like myself, I don't know how you were in your pregnancies, will have it on and off throughout the entire pregnancy. I don't know if that had anything to do with having a dog and picking up dog poo regularly.
Well, I didn't have a dog at the time. I did not have much nausea. I did have some. And I we're going to be basically talking about the best tips. Yes. And, when you've had a journey for fertility, what I find for myself personally, and certainly for our patient population, it's like you want to avoid doing anything unnatural because, oh my gosh, it took so long to get here. At least now while I'm here, please, what can I do for myself that's as natural as possible, right? So then and as you say, it typically starts at 6 weeks.
And for me, I was so excited to have nausea because it took me so long to get pregnant. I was like celebrating the feeling of nausea.
That's hilarious.
Maybe I willed it to be more. I don't know.
Yeah, no. And that's a really, really great point. And because when we're talking about the best tips, so I might as well just bring this up. One of the things that you can do is acupuncture. And the reason why I bring this up is because I've had women in my office, they'll say, I have nausea. I'm like, okay, do you want me to treat you for that? And they say, okay, because, we were really just supporting pregnancy at this time. But because they're experiencing nausea, it's like, okay, well, then let's treat that. And they come back the next week and they say, Mary, can you not treat my nausea? It worked so well that it freaked me out and I thought I wasn't pregnant.
Yeah.
Right? So it was very cute. And then happened.
Going away. Aww.
Yeah. And you worry, right? So,
yeah.
so there is that welcome to nausea when you've been having trials and tribulations, achieving this pregnancy, because you are so your eyes, ears, everything is wide open to make sure that you stay pregnant.
Yeah.
Right?
100%. Yeah. Yeah. However, if it's kind of getting intense and you're needing relief, there are a few tips that you can use. Obviously, get medical advice, see a practitioner, naturopathic doctor, ask your medical doctor. These tips can have evidence behind them, so discuss the tips with them. One of them is using vitamin B6, and vitamin B6 is one of the components of this medication that is commonly prescribed called diclectin. But you can isolate it and take vitamin B6. We'll talk about diclectin shortly, but vitamin B6 can reduce the symptoms of nausea. In addition, before I say in addition to, it's very important to not overdose with vitamin B6 because it can create symptoms of neuropathy. So any doses higher than 150 milligrams can be a problem. So make sure that you get the right dose. And that if you're taking a prenatal, that you're customizing it for you as an individual, and it's usually a slow release one is good. So vitamin B6.
I just so you know, I didn't have severe nausea at all, but it was like that unwell, yucky feeling. So I actually took B6 in the bee pops. Do you know about bee pops?
Yes.
So I liked those. It's like a lollipop, and I did like the green apple lollipops,
which is perfect
times a day
because it gives you a little bit of sugar. First thing in the morning. Normally we're like, no sugar, but it actually helps. This is another tip. If you wake up in the morning and have that or crackers by your bedside, not that we advocate, refined foods, but this is one time where, fruit or crackers or something that you can stomach can then help set the day up. So you get a little bit of blood sugar because eating does help, and then it can help you eat healthy other things. So higher protein diet can help, and even having a protein shake before bed and increasing your total protein to be at least minimum 1 gram per kilogram of body weight is very helpful. it's hard to get that in because often what do you crave when you're pregnant and feeling a bit nauseous, or maybe it doesn't even show up as nausea. It's literally like a boycott of protein. You're like, I don't want to eat meat. Like you're like nauseous by the smell of meat or it cooking or dealing with the raw. Even after pregnancy, if I smell bad food, even just very subtly, like, there's meat turning, I'll throw up. So I don't know if like my whole system shifted post pregnancies, but it's like this, you're wired when you're pregnant to not eat anything unhealthy. And it helps if your husband perhaps, or your spouse or partner, somebody else cooks your meat proteins for you, because it might not be bad meat, just that your brain kind of may associate with like raw meats with nausea. So that happened to me, and it helps.
Well, if I may add in, if we think about evolutionary times, and we are animals, sorry guys, we are, and like evolutionary, the survival of the fittest, women are wired as a pregnant woman to be able to discern things that are bad. So this nausea is actually helpful. We're wired with nausea to help us, prevent us from eating things that may make us sick, and that will, be protective for this developing fetus. So it's actually a positive thing. And the other piece to that, I welcome it a little bit, because we see so many type A personalities just that wants to keep going, right? You do all this fertility treatment. It's like, oh, well, I want to get my life back and I want to keep going. But then the nausea kicks in and it's like, oh my gosh, I can't move. And in a way, it's like, again, that protective mechanism to say, hey, we need to slow down. We are creating life.
Yeah. Slow down and eat.
And eat.
Don't
and
skip
rest.
meals.
And rest. Like I have people that feel guilty about having a nap. I'm like, have your naps. Don't feel guilty, because you're right. Because your body's doing like a marathon a day. Like I call it, like it's like you're knitting little blood vessels so that it's voluminous, because you're in the first trimester. That's what your little fetus is developing through, right? Like it needs to be fed, and simultaneously you're like building the superhighway. You're creating a placenta. That's like a lot of work, a marathon a day. So we do need to eat, and this is, as you mentioned earlier, it's like this is the only time we're like, you know what, if you need a little carb, it's okay, because your body's working so hard. It welcomes the quick sugar because it needs access to this quick sugar to build these superhighways.
100%. It's a miracle. I love it. What you're saying, it makes total sense. And thinking about my own pregnancies, I probably did rest enough. So I encourage anyone who's like, I'm tired. I'm like, well, okay, well, good. Listen to your body. Sleep, take naps. I was really good about postpartum though. Like when baby was sleeping, I was sleeping. I had no problems there. Yeah.
But so that would help nausea too, right? Like rest.
Oh, for sure. Rest. Yes. Yeah. The other thing that's helpful, according to research, ginger has been studied, and then synergistically vitamin B6 with ginger can help. So making sure that you take ginger at regular intervals throughout the day, ginger capsules. Some people do ginger teas. The evidence is based on capsules and like standardized dose. But I remember having ginger chews with the sugar.
Ginger chews, yes, I did that. And shashak cookies, which is ginger cookies.
Oh, I didn't know that.
Yeah, and in Chinese medicine, we certainly use ginger a lot, right? And but I love what you mentioned about the capsules too. And I think it depends on women and their gag reflex and stuff, because sometimes it's like you can't tolerate so many pills and capsules, or even the Chinese herbal teas that we're using for nausea.
Yeah, I'm glad you brought that up, because it's hard to take a prenatal capsule to swallow it when you've got this nausea. And sometimes the iron in the prenatal can create more nausea. So there are gummy prenatals that don't have iron in them, like chewable ones that you can continue to take your prenatal. And then that way you can get, your folate and iodine and everything else, but take iron separately. Or if you can have less nausea, then maybe you can eat your red meat.
Yeah. And that's great too, because like chewable is obviously chewable. So you're not like swallowing. And I wish I knew you back then when I was pregnant, because certainly I just kind of stopped prenatal. So when I was nauseous, and I think it's important to tell women, it's like, it's okay.
Yes, your
Baby
baby
will
will be.
develop. And like I say, it's like, listen, you can feel like crap, but your baby's thriving because you've done all your work. You've done the heavy lifting before. So hopefully, so that
Yes.
your baby just, sucks you dry.
Yeah, if anything, the prenatal's for you because
Yeah.
baby will just take. It's like the best human parasite. It'll take what it needs from you. It is helpful to take the prenatal if you can. So that's why there's options, but it's not the worst case scenario, because what's worse is if you're taking it and then you're throwing up all day, can't absorb anything for you. So, but baby
it's
will
only
be fine.
temporary. Yeah. So that's really great. And I think, so again, there are things that like rest. I actually say, because people can wake up in the night and they're like nauseous. So it's like, I leave crackers by the bedside table.
Yes. Yeah,
right. So like
sure.
even when you wake up or like right before bed, you have a little snack. Because again, if you're doing like marathon 24 hours a day, then it's okay to have a little snack. When I ran a physical marathon, I learned how to eat while running. Right. And I never thought that was a thing, because I'm like, why would you eat? And it's like, oh my gosh, but I actually needed it.
Yeah.
I needed the sustenance while I was running. So I would have these like power bars while I was running, whatever.
Yes,
so
yes,
this is you. This is like your power. Like I call them feedings. Like, it's like, forget the meals. It's like, you have to have lots of feedings.
Yes, exactly. Eat every 2.5 to 3 hours. You want to catch it before the nausea kicks in, because then it's really hard to eat when you're nauseous and throwing up. So, and then I'm going to say, let's kind of wrap this up, because we want to keep it, to the point and concise, because if you're nauseous, we don't want you to have to sit here and listen to us yapping. So to review, B6, ginger, rest, eating
acupuncture,
sufficient protein, and acupuncture. And we'll leave it at that.
If you can't do acupuncture, do acupressure on pericardium 6. And we'll show you, actually, Tanya is being our model, showing us visually on our YouTube. But if you don't hear, so go to our YouTube, okay? And we'll place it in our show notes. But it's really effective. And that's it.